Good afternoon, Dr. Sharma, and welcome again to another session on brain health.
Thank you, Dr. Vasconcelos. Good to be back with you.
Doc, today is September the 25th, 2020. And as we continue to speak on non-psychotic disorders, can you please tell us what is obsessive compulsive disorder?
These are disorders that are pretty painful to the people who experience them. Originally, they were classified on anxiety disorder, and there's significant anxiety attached to it, but they're now under the DSM-5, the new classification of psychiatric disorders. It's actually taken up its own place because it's been such a significant problem for persons who have it. So obsessive compulsive disorders really is about persons experiencing intrusive thoughts that they're fighting against. They're aware of them. They're thoughts that are pretty bad in terms of content. It's against their nature. So somebody could be a very religious person and having thoughts that are very satanic in nature or violent, and they're in church and these thoughts are coming to them. So it's very distressing, and the more they try to push them away, they seem to become more stronger. And it takes to take up a fair amount of time in the day. For example, obsessional thoughts we know occur for more than an hour during the day, and sometimes it takes up almost the entire day for very long periods. So the only respite people get is when they go to sleep. So really negative. So the obsessive part of this disorder is the obsessions or the thoughts, the intrusive thoughts that come in and that they're aware of, and they know that they're irrational thoughts, but they can't fight them off. So, an example of that is a person who had these thoughts that his mom would die. So there's this fear that is going on in his head that he's getting this thought, oh, your mom will die, or, my mom will die. And then he gets a compulsion now, which accompanies the thought. And the compulsion often is to prevent the thought from happening. So it's like a superstitious thing that people experience fairly regularly. You get a negative thought, oh, I'm not going to pass my exam, and then you do knock wood or make the sign of the cross, So it's a superstitious habit, but the compulsions for this disorder becomes extremely extensive, and that's where these persons usually decide, oh, can't take this anymore because the compulsions are becoming so strong. So this young man who had the thought that his mom would die started to get a compulsive behaviors, which was you got to go and touch a leaf at the end of the limb of a tree that was outside of his house. And so he had to climb up this tree and touch a leaf at the end of this limb, and that would stop the thought from happening, which it did. But then it would come back, and then it get more severe. And it says the thought is that you got to now go to the topmost limb and touch the leaf at the end of that limb. And he realizes this compulsion is quite dangerous. So yet he can't resist it. He goes right up to the top, and the limb breaks, and he falls down and breaks his hip. So now he's in the hospital, and he can't go and touch any more leaves, but the thought is still coming back. So he now tells the physician, so what really caused this was this obsession that I had, that something bad would happen to my mom. And the way to prevent it was to go and touch this leaf at the end of this limb, and it broke and I fell. So can you get me some help for this condition? So now he has two disorders, one a broken hip and obsessive compulsive disorder. Very extreme and very upsetting to people who get this. I actually have somebody in treatment who gets the compulsions that he must touch particular object, and you got to touch it for 1,000 times. So the extreme compulsions are so bad that it takes up a lot of time too. So he's going to have to touch this object for 1,000 times, and by the time he reaches 1,000, he's lost count. So he doesn't know if he did 1,000 or not. So he's going to restart the whole thing. So the people who are observing these individuals, it seems quite extremely funny, but or bizarre, but for the persons who are experiencing it, it's really very, very, very distressing.
Doc, who exactly can suffer from this condition?
So we usually see this happening in younger people. So in the early 20s, people tend to have more of the obsessions that happen to them. There's a lot more fear of the future and of life. So there's a lot of uncertainty. And especially with people who are vulnerable in the past to, very strict parenting habits. You usually see it happen with people who have been under very strict parental controls, where parents are very rigid in their own ways. The expectations are very high, so it creates a sense of expectation for the young person. So they develop a sense of fear and uncertainty about their lives and the future. So what we do as normal in normal cases is that we do have these superstitious habits and so on, but in this case, it seems to make those persons with that normal tendency go to an extreme type of behavior. But that's a kind of pattern we see. Persons who are vulnerable because of the way their parents were raising them. We also see it as a genetic condition because many of these disorders run through the family tree, and usually someone in the family would have that type of behavior or compulsive behavior. So it's something that we see happening from the genes, that is carrying this problem, and it affects the caudate nucleus of the person's brain. So it's clearly a brain dysfunction where the whole that particular area of the brain is overactive. The cingulate gyrus is affected. So um, we usually have to manage it with medications that tend to dampen down the drive from the caudate nucleus. Of course, we do also therapy, which can help. Cognitive behavior therapy is also very helpful.
Doc, how severe can the condition get?
Pretty severe. It's one of those disorders, non-psychotic disorders, that it carries a lot of distress and pain for the person experiencing it. I would often tell people that if you don't really want to have this disorder, if you had to choose any non-psychotic disorders, you don't want to choose this one. Things like panic attacks, while it's very distressing, are much more quickly resolved. Unfortunately, obsessive compulsive disorders require significant hard work, and also more than likely medication treatment. So it can be consuming in terms of the time that it takes over the person's lives.
Do persons seek treatment readily?
Unfortunately, no, and it's quite strange that the persons who have this disorder don't come out and seek the help that they should get. It's often tied to the embarrassment of saying that I have this condition. It's tied to revealing thoughts that are so embarrassing that they don't want to share it with anybody. And they do get relief by doing those compulsive behaviors. So they're sort of self-treated by compulsive actions. So I think it's one of the reasons they don't come out until it gets too overwhelming and very severe. But it can be managed if they're seeking help early rather than later.
Doc, what are treatment modalities?
So we would consider both medication management and therapy management. The ideal therapy for these patients is what we call cognitive behavior therapy. But the medication management is there, and in actual fact, there are extremely good medications on the market now that work. So it's under the line of the SSRIs, but there are some that are very specific for obsessive compulsive disorders, like sertraline and escitalopram. They're extremely good, the SSRIs that are developed. Along with that, though, cognitive behavior therapy works extremely well, where the person understand their thoughts, they understand what drives those thoughts, and they understand the irrationality of the thoughts, and they work to change their thoughts. So they can develop the power to change their thoughts using a good therapist, a good therapy. So, can it be done without medication? Yes. I actually have one patient who is a very young student in a university, Guyana, who's done extremely well without medications. And I was a bit skeptical. I said, well, you know, in most of my experience, I would use both medication and therapy. He said, no, I don't really want to use medications. I'm kind of against it in my personal belief system. Can we do the therapy? And to his credit, he has come through beautifully. He requires sessions, and he's actually learned a lot about himself. And he comes from one of those families where the parents were very, very controlling. There was a lot of expectations of high performance. So they sort of instill this sort of belief system in them that you got to be perfect. So the perfectionist type of behavior is linked to this condition. There's another side to obsessive compulsive disorders, which is called the obsessive compulsive or obsessional personality disorders, or the OCD personality disorder, which is a more perfectionist type of person. And these persons carry that trait, you know, they carry that type of behavior, wanting to be perfect and everything to be good and good in their life, and that they've achieved everything. So at that time, that's why you see it happening in that early 20s when there's the uncertainty of the young adult leaving home and now starting to build their own lives and settle up in their own career and relationships and marriage and so on, where that level of anxiety, uncertainty can trigger this condition into making it a big problem for them.
Doc, well, thank you very much. We thank you for your commitment and dedication in helping and educating individuals. And I look forward to seeing you soon. Any final thoughts?
Well, I'm going to say thank you for having me, and that we can have persons know that these conditions are problems within the brain. There's nothing to be embarrassed. Sometimes it's problems that our genes are, you know, causing us to have this dysfunction. And what is there to be embarrassed about? You know, it seems that there is such a big stigma to brain health problems or mental health problems, as it's commonly called, because of the attitude of people. And it's not the other person who is suffering, it's that individual themselves. So they got to look after their own selves and not worry about what people think of them. So letting go of the embarrassment and the shame of carrying behavioral health problems is very critical. And I thank you for this chance that we're working together to get this message across to many people. We see this obsessive compulsive behaviors now in the time of COVID, where people are carrying this cleanliness to the extreme, which I feel is going to damage a person's immune system. And it's something to think about, you know. But it's again times of crisis when you see these personalities get more stronger, and these behaviors get more stronger. More anxieties out there, more fear, more uncertainty. So we need you too, with good spiritual help and prayer, to strengthen the minds of people and become more fearless about the obstacles and work hard, do the right things to protect ourselves, but don't get so obsessive about it.
Well, Doc, thank you very much. It's important for people to always remember there is help, and we need to reach out for the help. Thank you. God bless you, and see you soon.
Thank you.